it's up to the students too. If they want to have their cameras on, it kind of helps with the dialogue. Or if someone has a question, then
Right.
sometimes I can see them raise their hand. Is
Right.
there something on Zoom that allows you to like notice when someone up?
There,
There's a chat box. You know what?
there's a chat box. I'll keep that open and I'll raise my hand if there's something up people want to ask you. All right.
Awesome.
Made it so you're the big picture.
Yes, I see. Thank you.
A couple more minutes. See, there's like 100 people in this class, but they can watch the recording later, so a lot of them don't show up.
Okay, that's fair.
Yeah. What's the dog's name?
Her name is Millie. Is she in here? Yeah, she is. Her name is Millie.
Millie. Gus is right over there. My dog's over there. I'm sure Gus and Millie would get along. Gus loves everybody.
Yeah, she's a handful. She like wants to know every dog, and then like 10 minutes later, she's like, "Cool, bored now." I'm like,
okay, what do we got? We're up to 20. Good. So what's your background before you did this? As long as we got a couple minutes.
yeah, definitely. So I came in the Army in 2005. I've been in for 15 years. I started off my career as a dental tech, mainly because I knew I wanted to go in the medical field. But like in high school, I was like, I can't focus for college right now. Like I just knew that I came from an Army family, so it was really easy for me to make that decision to enlist because I was like, I have nothing else better going on. And so I signed up my senior year of high school, and I came in as a dental tech, which was it was like a weirdly perfect thing because dental in itself was already kind of a smaller field within the medical field.
Yeah.
And yet we were very independent because dental clinics tend to be kind of off to themselves on base. They're not always the medical clinic or the hospital. So it was very interesting to kind of always be like medical, but also like not even tied up with the hospital stuff. It was always just a small staff of whatever clinic I was part of. I started off in Alaska, spent 3 years there. And then I got my hygiene identifier where the Army trained me to clean teeth. So I don't have an RDH degree, but I can cover basically 60% of the patients that we would see for routine cleanings. And that was a 3-month class. And the nice thing is everything medical is done in San Antonio. So I went home for 3 months. I got to visit my family after Alaska. So I was like, all right, cool. I went to Fort Benning, Georgia for a year. I got promoted. And so as you kind of rise the ranks on my side, you end up going more managerial. And so I really kind of stepped out of patient care when I got to Germany which I did 2 years there. And really started developing my leadership skills, running the floor, making sure every dentist had
cute. Oh yeah, that's what I was talking about. Aww.
Somebody's mic's on.
And then after Germany, I went to Fort Campbell, Kentucky, where I was kind of like, I'll be honest, I was in that mindset of like, okay, I'm kind of like under 10 years. Do I want to do full 20?
Right.
I'm kind of bored being a dental clinic manager. I miss patient care because I love kids. And so I talked to a career counselor and they were like, hey, have you thought about recruiting? And I was like, yeah, actually, it always seemed kind of interesting. I just don't know how to like apply for it or whatever.
Yeah.
And he was like, okay, how about this? I'll help you get your application done. I'll get it sent up and get you a slot for school.
Yeah.
And by the way, because you're medical, you're probably going to be a medical recruiter specifically because you have a clinical background. And I was like, well, yeah, cool. Double the fun there because I have a background in it.
Nice.
Because I can speak to anyone about being enlisted. There's certain just very common thread things that are being a junior soldier, junior enlisted soldier. But being dental, like I know the clinic atmosphere. And so sure enough, he got me a slot for school. I re-enlisted for another 3 years and was like, if I don't like recruiting, I can still get out after the contract. I wasn't what we call indefinite, where you're kind of in for the long haul. They don't let you do that until you hit 12. But at my 12-year mark, 10-year mark, I went into recruiting. I got stationed in DC as a medical recruiter and actually set up the station there. It's in Georgetown, which is beautiful, which is busy.
Yeah.
And having met a lot of success and having to learn, and this is why I love talking about HPSP, because I had to learn so many things about this program because the academic environment in DC is cutthroat.
Yeah,
If you
yeah,
don't know what you're talking about, you will lose
yeah,
a student's interest very fast. And so
yeah.
I wanted to be confident. I wanted to make sure I was giving, good
Uh-huh.
information. And it worked out really well. And then they were like, well, hey, the Albany station kind of needs some help. Would you mind going up there, sharing your
Yeah,
knowledge and training the soldiers up there? And so
right, right.
that's how I came to be in Albany, New York.
Yeah, nice. Well, good. All right, it looks like we're just about ready to go. People are coming. Let me I'm going to pin me for a second. Okay, people, good news. I came this week. I forgot last week, and I totally apologize for that. This week I am here, and tonight we've got Sergeant Chris Swan. He's going to talk to you about the health professions scholarship program and about how you can get the Army to pay for all of your schooling. So, I mean, like I was telling Chris earlier, your parents are probably like, if they go to grad school, how the hell are we going to pay for this? The Army will pay for everything. They'll pay for everything and give you a stipend while you're there. So what the hell do I know? I'm going to let Chris tell you about it. So I'm going to unpin me, and then there you go. All right, Chris, go ahead.
Alrighty, good evening, everyone. Thank you for taking the time out of your day to hear me rant about HPSP, or the Health Profession Scholarship Program. I represent the United States Army Medical Department. So the HPSP program I'm talking about is the Army's HPSP. Just so you know, going forward, the Air Force and the Navy do have their respective HPSP programs as well. It is considered a scholarship program. The details for the scholarship are the same no matter what branch. It's more down the line about residencies, and I will talk about that more, that kind of differ for the branches. But as Don said, so effectively, if you apply and get into a medical school and you apply for the HPSP, the Army will pay the tuition of your medical school and provide you a stipend on a monthly basis for 10 and a half months of being in school, and then the other 45 days you're paid as a second lieutenant. Because by virtue of applying for the HPSP, you're applying to become an Army Reserve officer for the duration of medical school, and then you will end up matriculating into the Army's active duty residency programs, or their GME program. So I don't know how familiar the group is with the whole residency GME situation, and I can fill that out in a bit. But yeah, HPSP, I think it's one of the best programs the Army has, in that it's not briefed about enough maybe to every college student who's considering being pre-med. To be fair, there is a medical HPSP, there is a dental HPSP for those who want to go to dental school. There is a veterinarian HPSP, however, it only covers the last 3 years, and so first year vet students apply in that window. So you already have to be accepted and started vet school to really be in the window to apply for that one, and then by the time everything kind of kicks off, they're covering years 2, 3, and 4. And then very low density, if you go into the Army's website for the goarmy.com, under AMED, which is Army Medical Department for short, then you'll see that there's also clinical psychology and optometry. Those are more limited scholarships. I tend to focus on the medical school and the dental school ones because those are all inclusive. They cover all 4 years of that professional school. So I think the easiest place to start is kind of timeline. You guys are in undergrad right now, declaring that you want to be pre-med, so you're taking all the courses necessary to be competitive for medical school. Part of that process to apply for medical school is the MCAT, which I'm sure a lot of you know. The Army has a requirement that you make a 500 on the MCAT with 124 in each category to be initially academically eligible. I say this because realistically, if you get a 499 or you get over a 500, but you got a 123 in one of the categories, we do have academic waivers. So if that ends up being the case, don't get deterred. You can still attempt to apply for the HPSP. I will say that because it's a waiver, that doesn't really guarantee that you'd be a primary select. But there's 300 scholarships annually. That doesn't sound like a lot, but when you're drilling down those who have the desire to serve, are open to the opportunities that the Army can provide them, then yeah, that can get kind of competitive. But applying early is a big thing, and I'll tap back on that here in a second. But as you're going through your studies, again, I'm not going to say this is the end all be all. This is coming from just having worked with students in both the DC and the Albany region. What I find to be typically a track for success is taking the MCAT in the spring of your junior year, summer between those two, or the early fall of your senior year, because the application windows are like June, October for medical schools. So you want to have an MCAT score on file. Granted, COVID made some exceptions this past year, but years before, having the MCAT and having your MCAT score taken care of in that window was really beneficial for applications. And that's the thing, you want to apply for HPSP alongside your medical school applications, because we do not require, in the Army at least, I'll speak for the Army's HPSP, we do not require a letter of acceptance to apply for the HPSP. We would just request a list of the schools that you've applied to. And actually, for those who know James Faraci, he applied for HPSP this year. He is currently in the process for applying to medical school, and he was selected. So he is now able to go to interviews knowing that he has a scholarship for medical school. And James approached us very early on, right when he was kind of starting his med school applications. And I like to use him as an example because he really is the ideal candidate, where he's going to have all the training and done in line the way it's intended to. However, the window for applications for HPSP go all the way from October, what would be your senior year, to the following August, September timeframe. We go off of fiscal years. So we go from October 1st to September 30th. And that's why having the application kind of started, the MCAT score on file. October is just the earliest we can submit you to a selection board. But so if your MCAT is done the late spring of your junior year or the summer of your between your senior year and junior year, that allows us to work with you because you have a GPA on file and you have an MCAT on file. The minimum GPA requirement is a 3.2. Let's be honest, if you're applying for medical school, you're probably striving to have a higher GPA than a 3.2. And medical schools are very competitive. So I definitely encourage those of you, because I'm understanding this is mostly a freshman group, your GPA, it is important. It really is. So please take your studies seriously and, get the best grades that you can in your classes, because it really does end up panning out for opportunities down the line. When scholarships are being considered and all they have in front of them is like, a black and white piece of paper, you can list your achievements and everything like that. But at the end of the day, your transcripts are going to play a factor into that. For medical school applications or dental school for the DAT, your DAT and MCAT scores, they're going to play a part. But one thing about the HPSP scholarship application is it is a whole person concept. So while we do have your transcripts and your MCAT on file, you also get to write a statement of motivation and you request letters of recommendation as well. Those letters can be the same ones that you're using for medical school. I think that's usually the easiest route. However, if you by chance know military officers who have served, whether they're retired or just prior service, those help for the selection because, as I mentioned, there's 300 scholarships. Well, October through, I'd say about March or April, if you apply, you have a really good shot of getting a first-time select if you have all the stuff that's needed for an application and you meet all the academic requirements. After March, though, that's where the number of slots starts to dwindle, and you have to, the selection boards can basically be a lot more selective. That's their job. But like they can actually start to really nitpick the applications and like, oh, okay, well, this person has a 3.4. Well, this one has a 3.5. We're going to go with the 3.5 and things like that. Whereas initially for October through March, you could have a 3.3 and you could be selected for HPSP. Because I've had applicants before get selected with a 3.2 and a 500, like the minimum standards, but that's what they are. They are for acceptance. So keep your options open on that. Now, with the application for medical school, that window usually closes in October. So if you've locked down a scholarship, the next phase is interviews. And this is really crucial because if you can say at an interview to a medical school, hey, I already have tuition paid for. The Army is going to pay my tuition. That really resonates with the medical schools because they get hammered if the students don't have feasible ways to pay off their tuition and they have way too high tuition debt rates. So you come in as a scholarship student, that's very appealing to them. So I'd say it's a competitive edge. You're also going to get amazing training through the Army, and that's more when I talk about the residency phase. But so you're in the application cycle, you're going through interviews, you already know that you've gotten selected for HPSP. Our process is not night and day. Like if your friend's enlisted and they got in the Army like 2 weeks later, to be honest, our process takes about 4 to 5 months. And so there's the application phase, the selection phase, then there's the commission phase, which is where you're actually signing your contract and taking your oath to become a reserve officer and be in the HPSP program. Now, you don't start receiving your stipend or obviously the tuition coverage until you start medical school, but a lot of this paperwork is preparatory, so that way when you start med school, everything just goes in line and you're getting paid on time. For those students who wait to apply for HPSB until they get a letter of acceptance, or just the summer because they're just like, yeah, actually, you know what, this tuition is looking really expensive, I would still encourage someone to apply, but just know that because the paperwork takes time to process, your tuition will get back paid. That stipend starts from when you get commissioned. So the earlier you get everything done, the more likely you're going to get your stipend the minute med school starts, versus it possibly being delayed into September or October, where the stipend does not get back paid. So just fair disclosure on that. That's a quality of life thing, because right now the stipend is $2,244. Yeah. 24.66. I'm horrible with numbers, I apologize. 24.60, it just went up in July, so it's kind of throwing me off. But that's $2,000 a month because it does get taxed, so fairly it's considered income. But that's to be a student. You're being paid to be a student, and your tuition's being paid. But what's the catch, right? So when you do medical school, it's 4 years. The HPSB scholarship is a 4-year scholarship, and the payback for it is 4 years in the Army as an officer, as a physician, once you graduate residency. Now, you're on active duty for residency, but you're not deployable. You can't be, you can't be moved anywhere. You're only going to wherever your residency site is. You're just enjoying the benefits of pay and healthcare and everything while you're a resident. And then your payback kicks in. And that's by default 4 years, because med school was 4 years. But this is you getting 4 years of practicing medicine. So if you go into family medicine, that's a rather short residency. So you go through your internship year, 3 years of family med. So that was 4 on active duty, but as a resident, then you do 4 more. And in total, you did 8 years on active duty. Half of it was training you to be a family medicine physician. The other 4, you were practicing family medicine on soldiers, their family members, retirees. You were getting a wide range of experience as a physician. That I think just really brings, some awesome opportunities to develop your competencies. And at the end of that 4 years, if you want to get out of the Army and go practice in a civilian clinic, by all means, you did your time, you paid your time back, but you're not coming out of the Army with tuition debt. You're not coming out, you're board certified, you've got a skill set, and so you're set up for success. And I think that to me is why the HPSB program is so phenomenal, because it's like, you're getting trained, you have no debt, and then you're free to practice, and you have veteran status when you're done, which it carries weight depending on wherever you retire or you get out at. But if you like what you're doing and you want to keep practicing and keep progressing in the ranks of the officer world, then you can just continue practicing and stay in the Army for 20 years. But again, your time started in residency, not when the payback started. So you've got 4 years towards, or 4 to 6 years, depending on if you like go to surgery or something. You have 4 to 6 years, though, of active duty time towards retirement, towards promotion, which is hugely beneficial if you end up being more career-oriented. And I don't know about you guys, I've seen a lot of my physicians that are over the age of 45. You can still practice years after you get out of the Army and retire. And that's what's very common is physicians tend to stay in and retire because that's a guaranteed pension for the rest of their life. And then they're practicing medicine anyway in a civilian clinic, making a lot more money. Comparably, though, Army physicians, they make more than the average doctor or average officers in their grade, because the Army does incentivize pay for skill sets. And so you're not going to make $500,000 like if you were a surgeon in a civilian hospital in Boston, maybe. But you definitely won't be hurting. And the things that you have to consider is you'll have free healthcare. If you have a family, and by all means, if you're in residency and want to grow your family, and I say this more for female soldiers and female applicants that are applying, but having a baby in residency can be very, very tedious in civilian residency programs. Through the Army, if you are pregnant and you have your baby, you have 12 weeks of maternity leave, and all the Army does is say, hey, pause on your residency program, go have that time with your family, develop that bond with your baby, and then after your 12 weeks, come back, and you just start where you left off, and you just graduate 12 weeks later from residency, which I think that flexibility is just a huge relief. And so I make it a point to always bring that up, because, depending on when people want to build families, that's kind of a time frame, is when you're between the ages of 26 and 34. So depending on how long your residency is and all that. But yeah, so that's, I think, a lot of the highlights to the program. You do the application, then you commission, then you start medical school. Now, one aspect that I get a lot of questions on is, am I going to go to basic training? No. You're coming in as an officer. You're coming in at a different route than I did and that a lot of the recruiters do. But you will have a foundation course called the Basic Officer Leader course that is done in San Antonio. Let me tell you, it's nothing like basic training. We do have a preparatory course that you go to before med school starts. It's a month-long in Fort Sill, Oklahoma. It mimics basic training to an extent, but it's more for like giving you a foundation of knowledge. Because again, you're coming in as an officer, they're not as hardcore. I guess that may be the only way to put it, is you're going to learn basic soldiering skills and get exposed to like what it's like to go to a range, what it's like to do PPE, what it's like to do a lot of the Army fundamentals. But yeah, you're not going to have drill sergeants yelling at you or anything like that. And then the Basic Officer Leader course, the actual Basic Officer Leader course, the following summer between your first and second year of med school, that one is more like what you're doing now in college. It's like PowerPoint driven. It's very much going to show you the professional development things that you need to know, how the Army Medical Department is laid out, and what career pathways you can take depending on what specialties you go into. They are really big about discussing fellowship training and also the leadership side. So an interesting thing about pursuing HPSP and coming in the Army as an officer is you're automatically coming in at a rank where you're a leader, and you're expected to have a certain amount of maturity and the ability to make, decision making. And pursuing becoming a physician also requires you to have that mindset. You've got to make decisions. If you have a patient on the operating table, you're the doctor. People are looking at you to kind of lead that team. Well, the Army also has you in that team dynamic. It's just there's also rank attached to everybody. So I think that kind of plays into it. But you're going to be sent to leadership schools to help cultivate and train you to be a better leader, for lack of better words. So you may be running an entire ward. If you stay in past your payback time and you start rising in the ranks, you can run the hospital. You can run a ward, a clinic. And those things are just broadening. They're experiences that broaden your expertise and give you just that much more skill set for when you pursue civilian medicine. Because there's a lot of physicians who end up not staying in patient care, and they end up going into the more administrative, executive kind of roles. And so some of this foundation that the Army has provided can really help develop you in that way as well. That was a lot of information in a short time block, so I just want to take a breather here and answer any questions up front. Do I have any? Yeah. No? Wow. Okay. So as I mentioned, medical school HPSP, the main route for you is to go from medical school into residency into a practicing physician. The dental HPSP works a little differently. So for some of y'all that were on the call really early on, I was telling Don that I started out in the dental field. So I was a dental assistant for upwards of 10 years. And as I rose in the ranks, I became more of a dental clinic manager. But that's really where my background in clinic life comes from, is the dentistry side. And so the dentists that come out of the HPSP program, dental school is also 4 years. And the dental HPSP is a lot more competitive because while we have the 300 scholarships for med school, we only have 65, and there's a one-time-a-year selection board for dental. So if you're planning on going to dental school right after undergrad, you're going to want to reach out to a recruiter in the summertime and jump on that application as soon as possible, because the board is typically between December and January. And that would be of your senior year. You do have to have a DAT score of at least 18 to apply for the dental HPSP and a 3.2 GPA, just like the medical side. But our dentists go through dental school, and then they're more quick to get their payback done because we don't require residency, even though residency is available. So if you want to become a prosthodontist or a periodontist, oral surgeon, you can go back to back into residency. It does accrue an additional obligation year for year of that schooling. But a lot of dentists just become general dentists where they do fillings and very, very basic dentistry, and they pay back their 4 years. And you can decide to go to a civilian residency program after that and get out of the Army, or go into one of the Army residency programs just later down the line. You don't have to go in right after you graduate dental school. But so their 4 years are done right after they kind of graduate dental school. And so that's sometimes, a bit more beneficial. Dental is its kind of own realm. So our clinics tend to be not always married up to the health clinics. They're very autonomous. And I think that's something I got to enjoy as a dental tech was I had a lot of friends that worked in the hospitals as medics, as LPNs, and some of the other medical MOSs that we have on the enlisted side. But I always kind of got to retreat away to my clinic, which was nice, and I had my clinic team. And there's a lot of cohesiveness because I was working side by side with officers every day. Because as a dental assistant, I got to work with a dentist. And then I got to do hygiene where I operated on my own. And that was another unique thing I think about Army dentistry was just how we empower enlisted soldiers to be very autonomous in that aspect where they're doing patient care under the supervision of a dentist because I had a dentist right next door. But the dental realm is definitely something that I didn't know I would enjoy as much as I did, which is why I think I enjoy medical recruiting is because I now know we have a ton of programs. And while chiefly the Army's HPSP program by far to me is one of the best programs because it's inclusive. It covers tuition, which is a huge deal for college students these days, and having a feasible way to pay it off. If medical and dental school and vet kind of falls in that same vein there, but if you are interested in nursing, if you're interested in becoming a physician assistant, occupational therapy, physical therapy, we have several programs, social work, that can really help out. Now, some of these other options, I'll be very upfront, they do not cover your undergrad tuition, or there's not really the loan repayment for that. But some of these have partner schools, and so you're on active duty for the school, and you're in San Antonio, but it's sponsored by a civilian school. So case in point is if being a physical therapist is one of your your goal, then you would do your undergrad in pre-med sciences. And then when you're applying for physical therapy school, you'd want to choose the Army PT Baylor program. And the weird thing about that, I say weird more so from my side, is that one is where applicants have to apply to the civilian school first and just indicate in the PT cast that you want to go to PT Baylor. They let the Army know that you're interested, and then we find you or we contact you and we work your Army side packet. And you've already done the civilian school side. And then they come together, and if you're selected for both sides, then you're going to be in the Army PT Baylor program, which is a doctorate in physical therapy. Those aren't cheap. And because you're on active duty for that one, you're not paying tuition for that either. The only difference with like those kinds of programs are you're on active duty for the actual schooling itself, whereas like HPSP, you're in a civilian medical school. And outside of the two trainings that I mentioned, your job is just to really do well, take your step tests, pass. I guess the first one's now pass, fail. So pass the first one, get a really good score on the second one so that you're competitive for residencies. But for the most part, you're not near a base, you're not in uniform, you're not really doing anything other than just being productive and going to graduate medical school. Those other programs, they typically require you to be like in uniform for school because you're in a classroom environment. It's just you're in an Army classroom. But you're still getting training from an accredited program. And so that's the big deal there is, okay, does this translate? Absolutely. It translates to getting a job on the outside the minute you get out of the Army. So you are civilian certified, but through the Army, and the Army paid for it. We have, PT Baylor, which is for physical therapy. We have a PA program. We have a Master's of Social Work program. So if you get your undergrad in like psychology, social work, or sociology, kind of in that realm, then you would apply for what we call the MSW program. And that one condenses the master's program into 19 months. And then you do a 2-year internship afterwards so that you can become an independently licensed social worker. And then you pay back, and it's a 4.5-year payback. So these programs have varying, payback times, but the common thread is the Army is willing to pay and train you. Your payback is just your time in service and helping soldiers and treating everyone who requires the services, whether it's medical, dental, or say like mental health. So things of that nature. And that's really just that's not even like the tip of the iceberg to me. These are the student-oriented programs that kind of either build off a bachelor's degree. And so once you complete your bachelor's degree, this is kind of like where you're preliminarily eligible. And just to kind of put it out there though, if, military service is something that you're really strongly considering and you just can't wait to do it, or you could use some financial assistance while you're in undergrad. The Army Reserve is great because one, the Army is not making you move anywhere. Two, I did not know this for the longest time, but Army Reserve soldiers, the enlisted ones, have tuition assistance. So the Army will help at least chip away some of your undergrad tuition debt. And the cool thing is that if you end up wanting to go HPSP or go into the MSW program, we facilitate a transfer from the reserves to those programs all the time. Because we have a lot of reserve soldiers who figure out way later in life that they want to do some of these professional careers. And they're like, well, hey, but I've already got like 7 years in the reserve. It's like that time is still going to always be yours, but we can facilitate this transfer if you're selected for our programs. So I always bring that up as a case in point, because actually a really good friend of mine is over there in Plattsburgh. And so if anyone's interested, I can provide his information. I know Don, he's reached out to you. Actually, I think he might have put us in touch. And so Johnson, not Sergeant Smith, Zach Johnson. So he's awesome. And he can elaborate more on all those opportunities if it's more like an immediate assistance that you would kind of need and you're open to serving. That does require you to go to basic though. So that's not to contradict what I said earlier. My programs as a medical recruiter though, you're coming in as an officer. So basic training is not in my, for the field of my applicants. But yeah, so I've kind of touched on quite a bit, and I just like to do these like check-ins, and I'm also trying to be mindful of time because I know Don, you said 50 minutes, so I don't want to run over if I'm running into minutes. But does anyone have any questions at this time? Okay.
I have a quick one. How about the travel? Did you get to do a lot of travel, and is that great? Or because I think that would be a lot of fun.
So yes, we don't move as often as I think sometimes the Army gets a stereotype for doing. Typically, you can expect to do 3 to 4 years in one spot, but the locations you could be stationed at, they range all the way from, we have several bases here on the East Coast. We have some in the Southeast and the Midwest, but we have overseas assignments like Germany, Korea, Japan, Alaska, and Hawaii are considered overseas because they're just not part of the continental United States. I get it. They're one of the, 2 of the 50 states, but they're considered overseas for the Army's assignment purposes. And so as a physician, especially, depending on what type of physician, and I think that's a really big consideration is how does your specialty apply and how, to what situations. And so if you're a general surgeon, you're more than likely going to need to be stationed in a hospital because they have surgical suites and they have to be able to accommodate that. Whereas if you're family medicine or internal medicine, you're more primary care oriented. And so you can work in a clinic, you can work in the field units a lot more, flexibly because it's a very broad field to be in. But yeah, moving, I love moving. I grew up in the Army. So for me, I itch every time I've been somewhere for more than like 2.5 years. I'm kind of like, it's time to go. Where am I going to next? Because I love moving. I've been to Germany, Alaska, Georgia, Tennessee, DC, and now in New York. So other than the West Coast, which that's what I'm trying to like negotiate next is going to the West Coast. But in having a say where you go, I'll be honest, it's not 100% obviously because the Army only has so many slots for, whatever specialty someone's in and what they're requesting. However, the Army does try to work with people, and it's about networking. I think if there's anything you kind of learn in college and in professional schools is network. Just, you never know when you're going to need to tap into someone's information or resources. And that's how assignments work. There's an assignments manager for every field, and they know what slots are opening. And whenever you hit the minimum time of being assigned somewhere, then they can, work with you to get you the next place to where you want to go. And speaking of locations, so kind of back to the med school track, the civilian match occurs in October and you find out results in March. HPSP students are matching against a smaller pool. You're only matching against the other 299 people who got the scholarship. So that being said, our match rates are really high. And this relates to location because not every hospital has every residency, but we have 10 training hospitals. And that's where I think we have the advantage over the other branches is The Navy and the Air Force tend to outsource to civilian residencies if you even go into residency primarily. With the Army, that's our primary track for an HPSB student. So right now we have an 87% first-time match. That means 87% of our students know that they got what they wanted for specialty, and they're going where they want to go. Some of our major medical facilities are Hawaii, Washington State near Seattle. We have Fort Lewis, Fort Hood, Texas, BAMC, which is in San Antonio, or now it's called San Antonio Medical Center, so SAMC. We have Walter Reed in DC. We have West Point, Keller Army Community Hospital, about 2 hours south of me. So I'd imagine it's probably closer to 5 hours for you guys in Plattsburgh. But they're all over the place. And then we have major medical centers that are not training sites in, again, Germany, Hawaii, Alaska. So the travel part is definitely a component of being in the Army, but is it one of those things where you're going to move every year? No. You're likely to do residency in one place. You may go to another place for your payback time. And then if you decide to stay in the Army and you want to pursue fellowship, that'll instigate another move. And another area is obviously deployment. So deployments are not considered assignments like in the same traditional sense. However, like say you're stationed in Walter Reed and they need a surgeon and you're a surgeon, then they can say, hey, we need to attach you to this unit that's deploying because they're going to need a surgeon for the duration of their deployment. Again, you can only be activated for deployment when you're in the payback phase, that 4 years of payback time. But that's part of the Army's medical mission, is to provide care both stateside and abroad. So if that's happening, it's because they've identified they need that specialty. But that means they also have the facilities and resources on the other end to accommodate you. So, and that's what I tell people. I'm like, I've been in for 15 years and I've never deployed because there's only so many dental techs that need to go versus how many of us there are. But I volunteered because I was so ready to go. It never happened. So that's a reality too, is like, hey, you may go, you may not. And when you do, you're doing your job over there. That's the point, is you volunteer to come in as a doctor. Other people come in and volunteer to do other jobs. So the Army's not going to reassign after they just spent like $500,000 on you, because you have to think your stipend, medical school tuition, it adds up. But yeah, so I don't know if that covers the whole breadth of travel, both leisure and mandatory travel. Any questions after that?
Come on, people. We're all part of this. We're all here together.
No questions.
No questions. Comments?
Anything I can elaborate more on that I might have just kind of, I don't know how I might have glossed over. I try to be thorough, but without losing you guys.
So
all good opportunities though.
Before we started, we were talking about your dog and how she was a handful. Can you tell us more about that?
No, she doesn't like it when I ignore her, so she's chewing her feet right now.
I think the great thing about Zoom is we're all getting to know each other's dogs.
Yeah.
As you can hear my mind whining over here, but he wants to go out. He has no idea where he's going. He just wants to go out.
Yeah, she gets a little restless because like being gone all day. And then I come home and she's like, yeah, you're home. And then I'm like, got a presentation, sorry. I'm not center of my universe just yet. But when I was mentioning leisure too, so I kind of did mention this, but kind of like quality of life things for the Army though. We get 30 days of leave a year. So after the first year, you have 30 days in the bank. And I'm at like 60 because you can carry days over. I cannot wait for the holidays because I'm actually going to take the holidays off this year and give her the much needed attention and my husband. But because, I work a lot sometimes. But
yeah, but he understands and she doesn't.
Right. Yeah. And so, but it's kind of nice to know that like I can do that though, and it's not going to affect my pay. It's not going to affect anything to do with my job, because really the winter holidays is everyone's kind of relaxing, and I think that's super cool. I
hate to brag, but I work 30 weeks a year and get 22 off.
That's nice.
I don't hate to brag. I love to brag. Who am I trying to kid?
I thought I had the good deal here. But yeah, it's definitely one of those quality of life things that, you know, not having to worry. So my husband's diabetic type 1, and we don't worry about his medications and stuff because we have TRICARE, which is the Army's health insurance. And I think that's an interesting thing when you're coming in the medical field, is being a part of a bigger organization that your patients are also doing their part in the Army. They're doing their job, and your job is to make sure they can go back and do theirs. Even cleaning teeth, that was therapeutic for a lot of people. There's a lot of people who want to have clean teeth. Got it. You know, I always kind of wondered whether my job was really significant or not, because it's preventative maintenance more than anything. But sometimes you're able to be like that positive influence, and I wouldn't take it back for anything.
Yeah, but that's also how you keep your teeth, because I know I went without the cleaning for a long time, and when I first started going back for cleaning, so many of them had to be filled, you know?
Yeah.
Yeah.
I miss it sometimes.
Yeah. All right. Well, I think we're just about ready to wrap up here. Does anyone have any questions, or we ready to let Chris go?
I have a quick question.
Go ahead.
What's going on?
Hi, my name is Lexi. Could you elaborate more on the physician assistant like program that not program like the, I don't know if you know what I'm talking about.
Yeah, so like becoming a physician assistant and being one in the Army?
Yes.
Okay, so physician assistants, there's 3 routes to really kind of consider for this. So the Army has its own in-house PA program, but you have to be enlisted for at least 3 years to apply for it. And so, but there are reserve PA slots too. So if like you go in the Army Reserve, you can be an Army Reserve PA, which is great because the PA school in the Army is 2.5 years long, which is normally they're about 3. And so you're getting your master's in physician assistants that way. But Army PAs are a large part of our medical reaction teams and triage. So a lot of our physicians don't actually like go to the front line per se, but the PAs are that provider that works with the medics and provides that on-site care. And then in hospital stateside, they're utilized in almost every department that we have in a hospital. The emergency room, surgical suites. You can subspecialize as a PA as well.
They have no idea when they talk about the Biden economy. The Biden economy was stagnant. Wage growth was stagnant.
Someone's got a live mic. Dividing economy. But with PAs though, so if that's not the route you go though, you can go through a civilian PA program and then apply to join the Army active duty or reserve, and then we have loan repayment. And so that really tends to be beneficial because we're critically short on PAs every year. And that's really because let's think about it. Like once you're PA certified, trained, and you have experience in a resume, you're marketable. So if those 2 don't retire, they get out, they get hired on relatively quickly. And that's pretty much the 3 routes: active, reserve, and then the what we call the IPAP program, which is the homegrown Army one. And that's sponsored through the University of Nebraska. So while it's done in San Antonio and you do a phase 2 at another base, it's your the schooling is accredited by University of Nebraska, and that's who your degree actually comes from. Did that answer your question?
Yeah, thank you.
Yep, no problem. Any other medical interests programs that I didn't touch on? Because really, we have 6 cores in the Army Medical Department. Medical physicians, that's just one of them. We have dental, we have nurse, we have PAs that fall under the specialist corps, along with physical therapy, occupational therapy, and dietitians. And then we have the med service corps, which covers pretty much, if it wasn't in one of those, it falls in the med service corps, which clinical psychology, social work, optometry, lab sciences, microbiology, biochemists, clinical lab officers. So there's a breadth of opportunity depending on what you guys want to major in, study, and then eventually practice or work on.
Do you have any room for old people? I mean, like, let's say someone who is like 57 looking for a career change. Just asking for a friend.
Quite honestly, I can process a physician who is in a critical shortage specialty, like a surgeon, orthopedics, OBGYN at 55.
Okay, so we're talking hypothetically here. What about a pharmacologist who was tired of his job?
So unfortunately not, because so actually, let me ask that question. So pharmacologist versus pharmacist, what is the difference?
Oh, so a pharmacologist is like a scientist who does research with drugs versus
Okay.
a pharmacist is more a clinician who dispenses drugs.
Gotcha.
Yeah.
Because I think it's interesting if there's one that you just brought up now that I wouldn't say the Army couldn't bring on a pharmacologist. I just don't think it's not labeled as a pharmacologist, but it might be one of our lab scientist positions.
Right.
Because again, having like a PhD, and then the Army does its own research on things like we're doing research on COVID.
Yeah.
Because we need to find a vaccine.
Right.
So the Army is heavily invested, and that's another thing. Patient care, awesome. Not going to take away from it. Research is a huge part of the Army Medical Department as well, and I don't think a lot of people spotlight that enough. But with the COVID outbreaks, when we set up in New York City and we activated field hospitals, yes, that was to help triage and patient care. Yeah. But we also deployed a lot of Army scientists from across the nation to New York and Washington to study, take samples, and to assist in that fight to find a vaccine. As they're still working on. When Ebola broke out in Africa, we sent scientists. We have Army scientists, and actually in this region, we have Natick over near Boston. That is a huge research facility. So if anyone ever wants to talk to an Army scientist, I have a couple of contacts as well that I would put you in touch with, because I'm not going to remotely try to explain it.
Yeah, and one of the untold stories of the whole COVID thing is how, like, when it first hit, it was novel. No one knew what to do or how to treat it. And they're hitting it with everything they got. But now they understand better the disease process. And even if we don't have a vaccine yet, they know better how to treat it. And they're saving a lot more lives. So the science part's important.
Absolutely. But to touch on the original point was about age. So if you're pursuing these direct commission, what we call direct commission routes, just bear in mind the age limits are 42 for active duty and 40 for reserve. So I know that the student demographic here is not really maybe in danger of that. I will say you have to be 21 though to commission. So that's one of those things that I actually, I want to say I've had 2 students that had to kind of wait to commission because they were selected for ESP and they were authorized to commission, and I was like, they can't sign their contract until like next week, and they're like, I'm like, no, they're not 21 yet. So they were like, oh yeah, that's too easy, have them sign it the following week or whatever it was.
Well,
but
the nice thing about that is when they do sign, you can have a drink with them.
Can't recruit propriety, unfortunately, but raise a glass in my house and be like, congratulations, you.
Okay.
I know, right? It's like professional world ethics. A lot of trouble for that one, but I totally get on that. But outside of the other question, I really want to make sure we address everyone's, just even if it seems like a fleeting interest or anything like that.
Yeah.
I love getting new questions.
Yeah. Well, I'm gonna put all your contact info up on our website, and if they have some more questions, they'll get in touch with you directly. Okay.
Awesome. Yeah, everyone, thank you again for your time tonight. If you reach out to ask a question or get some more information, that doesn't mean you're signing up for the Army right away. Like I said, it takes months. But I believe in everyone being as fully informed about your opportunities. So again, thank you. Thanks, Don, for setting this up. I look forward to working with everybody in the future again and presenting. And you guys have a great night.
Yeah, you too. And thank you so much for coming. This was awesome.
Thank you.
Thank you.
All right. Good night, everybody.